Dr. Bombi, welcome back to the show.
Thank you, Richard. Appreciate it.
Dr. Bombi, let me get as long as we're on the thread here, you heard that I haven't talked to you since the two accelerated doctors have come out. You have referred to it in conversations to me as they're kind of false prophets. What is your issue precisely with what they said?
So the fundamental question here is the virus lethal or not, and how bad the lethality is? There is enough evidence. If you look at New York, for instance, they have, I'll just throw some numbers at you, and let the numbers speak for themselves. So New York City has 8.7 million people. 160,000 people have documented infection, out of which 41,000 end up in the hospital. Okay. About 17,000 are dead. So 17,000 people are dead in New York City alone, not New York State. 160,000 people have the infection. So then the governor there introduced antibody test, which has its multiple flaws. But having said that, that antibody testing showed that about 20% or 21% of the population of New York City had the infection, which means 1.7 million people. So 17,000 people are dead with 1.7 million infected. So that gives us what's called infection mortality rate or infection fatality rate of 1%. Okay. Now that 1% is true if no further person dies. But here's the problem. Out of the 160,000 people who have the infection, only 40,000 or so, 45,000 or so are settled cases, meaning either they lived or died. So in the settled cases, the mortality exceeds 40%. So you have another 115,000 people who still have active infection, still are in different stages of infection, some in ICU, some in hospital. So the mortality rate isn't going to go down. It's going to go up. And already at 1%, it's 10 times the flu mortality. So there is, when we tend to minimize the lethality of the virus, we take the risk of increasing complacency in people and overburdening the society again with the resurgence. The fatigue in society is real. And as you will remember, I've been one of the original people who've been saying that we need to open the economy. I sent an op-ed to Bakersfield, California on April 9th that was published on 11th, that we are wasting our capacities in the hospitals. We need to take care of people. We don't want to trade epidemics. But at the same time, we should recognize this virus is a serious virus. We just can't sweet talk its virulence. And we also know what works. The flattening worked. The tools of flattening will need to be adopted. We need to have a balanced approach going forward. Open the economy, by all means. Everybody wants it. Most people want it anyway. And we have been open all along. So Central Cardiology, Centric Health never stopped working even for a single day. We work 7 days a week. So I encourage to open the economy knowing what works and what doesn't work. What doesn't work is false bravado. What works is social distancing, alternate workforce, all the hygiene measures, and everything else. So I don't take sides with a particular thought process, but when you come from a position where people revere or respect your opinion, and somehow you can direct them and expose them to danger, that's not a thing that society should accept or condone.
Well, that's interesting. Those New York statistics are interesting. You said, let me make sure I got this right. I don't want to misspeak. What it came down was a 1% infection mortality rate, which you said is 10 times greater than the normal flu. Is that correct?
That's right.
Okay. Now, can you extrapolate that? Can you take those numbers and overlay them on California or LA or Bakersfield, or is every geographic area so different that you need to run their own numbers. I mean, numbers that might not reflect the lethality because of the space that we're afforded here, particularly in Central California.
Absolutely. Excellent question. Excellent question. So the 1%, again, I want to emphasize, is not the settled number. It's going to go higher. The 10 times is not the ceiling. It's evolving ceiling is going to go higher. As far as if those numbers can be extrapolated in other areas, the answer is no for a variety of reasons. One, the demographics. If you remember, the Hispanics and the African Americans are disproportionately affected and carry the largest burden of mortality and hospitalizations. So that's a significant socioeconomic factor. Second thing we talked repeatedly on your show is dose and density. It's necessary to minimize the exposure, the amount you get in a single interaction, and the duration of exposure. If you're exposed to infection for several hours, even if it's minimal, it increases the amount of inoculum or the dose of infection you get. And that puts your immunity behind, and your body doesn't get a chance to catch up. So the virus becomes more lethal. So New York being densely packed, a vertical city, it has its disadvantages where interactions are more intimate and the risk of getting infection at a higher dosage is higher. So here, if I have to name the points. One, dose and density works against people in New York City. Two, the socioeconomic factors with the African Americans and Hispanics. Three, when you have a torrent of infection, the sick people overwhelm the system, and some of the sick people don't get the care as they would have gotten otherwise. So there is a preventable mortality that adds to the total numbers.
Oh, that's interesting. I'm not trying to get you involved in local political squabbles at all, sir. I am not. But we have a case here where the mayor of Taft, California, and I'm sure you've been to Taft, talk about wide open spaces, wanted to partially open his community, I think, to barbershops and those type of things. We're going to have him on right after you on this program, Mayor Dave Knorr. And the county health department said, no, we're under state orders, and until the governor lifts or amend those orders, you have to comply. Do you believe philosophically, maybe not so much in the case of Taft, but philosophically that individual communities should be able to chart their own course out of this? Or do you think it's better that the system that we currently have, where a governor makes the call in a very, very large and diverse state where we're all kind of playing by the same rules?
It goes back to what America is. America is a ruggedly individualistic country where there is a federal system and everybody believes in their freedom and cherishes it and expresses it in their own ways. If I have to give you a scientific answer, I think it should be centralized, cohesive, evidence-based template that's reproduced in every community. There is no reason to reinvent the wheel. But that's not who we are as a nation. And that's our strength. And sometimes it also can be a challenge because not everybody with a different strategy is going to come out winner. What I'm looking at is, as these experiments are conducted in different parts of the country in different manners, we still will get evidence-based medicine. We'll still borrow those practices after the rush to express freedom and autonomy over science settles.
That's interesting. We're talking to Dr. Bridge Bombi of Bakersfield Heart Hospital. Dr. Bombi, let me ask you this. When you look at these statistics in Kern County, where we have now, I think, had 6 deaths, we're approaching 900 people infected with the limited testing that we have done, do those tell you anything about where we are in Kern County in terms of flattening the curve, or our ability to look forward to a time when we're starting to go back to restaurants and opening movie theaters and gyms and hair salons?
We've been fortunate in Kern that our numbers have been manageable. I think with that kind of a number, we can, using the standard protocols that we discussed, social distancing and all, we can go back and open the economy. And it's going to be a tiered, staggered way of doing it. You know, movie theaters will need to be reconfigured. You can't just sit right next to each other because the virus isn't going away. People don't have the immunity. So if we overlook that, we bring the resurgence. So we have to be constantly vigilant about the possibility of having an exponential growth in infection if we don't observe those social distancing measures. If you open restaurants, it's the same thing. There has to be separation. We just have to reconfigure our social experiences till the time either we have herd immunity or vaccination.
And I know you've addressed this before on this show. Talk to me what herd immunity would look like in Kern County.
So the herd immunity is that a majority of the population, let's say 2/3 of the population, has been exposed to the virus and they have acquired immunity to it. So it makes the virus difficult to jump from a person to person if 2/3 of the people don't conduct that electricity or the infection. So it makes the virus useless. It can, if it doesn't transmit, it doesn't exist. So the way you acquire herd immunity with the COVID is that you open up the system and allow the people who are less susceptible, meaning people under the age of 60 or 65, who don't have significant comorbidities, and let them go back to the economy, observing the social distancing measures, and there will be infection, but the likelihood of those people having fatal outcomes is very low. And if we don't go that way, the likelihood of a fatal outcome for economy is very high. So that's the middle course. You build the herd immunity by letting the healthier segment of the population while insulating the more exposed segment of the population.
And can you achieve, and I apologize, I'm obviously not a medical doctor, can you achieve herd immunity with a virus that develops antibodies, but we're not sure yet if they provide any protection from getting the virus again?
That's a conundrum we're dealing with. There is a thought out there that there is some people who get reinfection. So I think there have been 160,000 cases, 160 cases of reinfection in South Korea, for instance. And I read somewhere there were 6 cases in this country. But we don't know if it's reinfection or the virus shedding or whatever. We're still struggling with those things. But our hope is that if this coronavirus acts like the other coronaviruses, then there will be immunity, what we call neutralizing antibodies, the antibodies that neutralize the virus and protect the person who had the infection for a period of time. And we don't know the duration of immunity and the efficacy for immunity. Those are questions we should have answers to in the next few months.
Okay. What is your best guess when you your best guess for when it sounded like you're implying that Kern County, because we have managed this process, is nearing a time that we can start reopening businesses with proper precautions. If it's a movie theater, that you have the proper social distancing. The same thing in restaurants. Is that correct? Are we nearing that time?
I think we are nearing that time for multiple reasons. One, I think from a medical standpoint, if we do those things, our systems were never tested. We always had more capacity than we ever utilized. So we are comfortable that our capacity is okay as long as we observe the social distancing. The lackadaisical behavior is the only thing that scares me that somehow we feel that we have won this battle. No, we haven't won the battle. We have learned the rules of the battle, and we can play within those rules to make the make economic viability a reality.
Right. And Dr. Bami, final question. You just referred to it. Let's say that 95% of the people in Kern County play by the rules, but you have 5% spread out all over the county who say to hell with it, and they become infected and they infect other people. My question is, can a small percentage of people screw it up for the rest of us?
There will be clusters like that. So again, it's going to be a whack-a-mole strategy. There will be some people who don't adhere to the instructions, and yes, there will be sources of either as asymptomatic virus shedders or otherwise spreading the virus. So that's a risk we have built in the system. But hopefully, those numbers are small. Let's say 5 people in a gathering wear masks, one doesn't. The chances of the one who doesn't wear the mask of getting the infection and infecting others is lessened because the other 5 are taking the precautions. So the nuisance value of somebody who is rebellious and doesn't want to adhere to the accepted norms is somewhat attenuated because other people are observing.
Oh, that's interesting. So, okay, great. Well, another great segment, Dr. Bombi. I want to thank you again, sir. Thank you on behalf of the show here for joining us. You add a lot of depth to it. We appreciate it, sir. I'll talk to you next week.